I believe that structured diabetes patient education is very effective because there's such a lot for the patient to learn, and all patients learn at different rates. You know, they have different capacities for taking in information. So when you have a structured plan, you can go through step by step with them, ensuring that they get all the information they need to self-manage their diabetes. I noticed that you've had diabetes for about 3 years.
Correct.
And you've been managing quite well until recently, is that right?
Yes.
And you've noticed that a few of your levels are now a little bit higher than what they should be.
Yes.
Well, diabetes is one of the only chronic diseases that is self-managed. So on a daily basis, people are making a decision about what they eat, how much they eat, when they're going to exercise, what medication they're going to take, and when they're going to monitor their blood glucose levels. And that's because type 2 diabetes is a progressive disorder, so things are changing all the time. Now, I'd like to have a look at your monitor if I could. Okay. All right, so you've been having a few high fasting levels, I can see.
Yes.
What medication are you currently taking at the moment?
I'm on Amaryl 3 milligrams.
When I see a patient the first time, I would see them for 50 to 60 minutes, and then they would normally come back for a review, which is about 30 minutes. And then if they're suitable for groups, I would encourage them to attend group education, which is normally a group of 3 hours. Okay.
That's good.
As part of that, the patient then is seen also by a dietitian. Now, each patient is entitled to 5 referrals to an allied health professional in a calendar year.
My name is Leonie Tolk and I'm a practice nurse at Valentine Family Medical Practice, and we're about 20 minutes out of Newcastle. So this morning's session was working with one of my diabetic patients and inviting Annabelle to join us.
All right, that's really, really good.
It's really important that when we're actually looking at diabetes, it is a progressive disorder, and that we actually work in an integrated care team. And what that allows us to do is to actually bring people in with more specialised skills and knowledge to improve the patient's education, improve the outcomes. It's also a fantastic opportunity as a practice nurse to actually listen and actually learn from the diabetes educator ideas that we can be integrating into our care with our individual patients as well.
Let's talk about your portion control. So if you get your dinner plate, you should be aiming at like about a 9-inch dinner plate, visually divided into quarters. Now, 1 quarter should be your protein. So that will be your meat, chicken, fish, cheese, eggs.
Every single time I work with Annabelle, you know, whether that would be in a formal practice nurse education environment or whether it's actually with a patient, there's always something that you pick up. So it's whether it's how she's positioned something, how she's simplified an explanation, how the patient's responded to something that she says. You go, okay, that's something how I can incorporate into when I'm dealing with patients as well.
Yeah, the potatoes, pumpkin?
No. Parsnips and corn.
Right.
Because remembering that diabetes is a disorder that affects all socioeconomic groups. So it's really important that we try and customise our delivery of education to each individual patient, and how they learn, how they take information on, and how we can motivate them.
Leonie, I believe that you set some goals with Namas when he last saw you. So let's have a look at some of those. How's he gone?
In fact, we did. So there was 3 goals. Do you remember, Namas, when we spoke 3 months ago? Lose 3 kilos in the 3 months, have 2 alcohol-free days, and the third one was to actually increase your walking 5 days a week, 45 minutes.
As a diabetes educator, I find it vitally important that I work closely with the practice nurses. I realise there are some educators who are a little bit scared by the practice nurses, thinking that they're going to take over our roles. But I think as an educator, I work towards bridging that gap, and I do a lot of training with practice nurses, so to bring them up to speed, and I act as a resource person for those practice nurses.
Yeah, I'm such a great fan of this integrated care model because, of course, we don't have the time to spend with each individual patient that we would love to do. So working in a integrated care model, it means that we can actually share that education, share that overall care. It means we can be seeing more patients.
It's reminded me that I've probably not been as compliant as what I should have been, and I need to be a bit more vigilant in my diet, and probably reduce my alcohol intake, and attempt to do a bit more exercise.
It is definitely cost effective because the cost of having diabetes is enormous. So if people aren't being educated and are developing the complications of diabetes, that is costing the health system an enormous amount of money.
We know that patient outcomes are improved. It absolutely decreases their risk of developing comorbidities, and it improves their overall quality of life. And it's amazing to be part of that team where you know you can make a difference. But as an individual you don't make the difference, it's as the team you make the difference. And it really is that patient being the centre of the team that actually makes it work.